Yeah, so our study looked at the maternal stroke rate in the United States from 2025 to, from 2015 to 2024. And we were looking at the incidence of stroke and also at the trend of the stroke. How did the trend go upward or downward? And then we looked at the effect of maternal stroke on the outcome of pregnancies. So what we found is the incidence was 48 per 100,000 pregnancies, and we looked at pregnancy as distinct event, and not that patients. And then we found when we looked at the trend of stroke overall, when we combined all strokes together, the trend was relatively stable. Then we divided them per stroke type. And we found an increased incidence of ischemic stroke, and that goes along with what we know from prior studies. The other types of stroke remain the same. And then when we looked what is the effect of stroke on the outcome of pregnancies, we found that patients or pregnant women who had strokes had higher risk of complications either during pregnancy or after pregnancies, and also the babies that were born from women who had stroke, they had also more complications. Yes, it's definitely, and we know from physiologic studies that pregnancy changed that physiology a lot, and it does increase the stress on the heart and on the brain. So it is kind of stress test, yes. I think it's multiple factors. I think access to care being probably the most important because we are in the United States, we're more of secondary prevention. We're not primary prevention. Unlike Europe, we are more focused on primary prevention, but also we do have higher comorbidities here in the United States. Yes, we should. And the reason why we did that 6 weeks is just to be able to compare it to prior studies. But we know the risk goes, further than only 6 weeks. We don't know when, at one point after pregnancy, the risk goes down to, pre-pregnancy risk, but it definitely goes beyond 6 weeks. There definitely need to be more work on that, and it's not because of they're not equipped. It just stroke usually it's not something that comes to mind during pregnancies, and more importantly, before even the patient makes it to there, we need to have recognition of the stroke symptoms and recognition from pregnant women that stroke could happen and calling 911. And also, we need more education not only to the patient but also to the providers because even us as stroke providers, we don't really think of stroke as the first thing when we hear a pregnant woman, but it can happen, and we really need to be thinking of it to be able to prevent it, because brain is time, or time is brain. Sorry. I think it's really hard to know what came first here, because it could be that the patient had complication that led to stroke and also led to lower birth weight or higher or lower Apgar score, or it could be the other way around. The stroke itself put a lot of stress on the pregnant woman that led to complication during pregnancy, that led to complication from the neonatal. I think it will be really hard to do that. I think that's something AI will probably allow us to do it down the road. But to be able to do that, we really need more prospective study that involving all the pregnant patients and then trying to identify these pregnant patients who had or pregnant women who had stroke. That's the only way to be able to have a calculator or any risk predictor model. Yeah, I think the two very important point is that stroke again could happen at any age and also including during pregnancy. So recognition of stroke symptoms really very important. That's again not only the women but also the providers. So anything that any stroke-like symptoms like weakness, numbness, vision changes, or speech difficulties, it should be treated like stroke until proven otherwise. And the other thing is, when we look at the U.S. compared to other countries, we do have higher incidence of maternal stroke. And the incidence, unfortunately, is not going down. If anything, it is going up. If we look at the just stroke rate in general, stroke rate incidence in general, it is actually going down. So I was hoping when I did the study to see the same trend in maternal stroke, but it wasn't. It was actually going up. So we need to make a lot of more effort to try to decrease this incidence.